Hey guys, I'm here to talk to you about art therapy. So, I have three objectives that I hope that you can obtain by the end of this presentation. First one is discussing what art therapy can include. The second one, explain how art therapy can influence other people's lives. And the third one, stating at least two ways that we can implement art therapy in the hospital. So what does art therapy include? So we know that art comes in like all different shapes and sizes. You can paint, you can use markers, you can use crayons, you can use stamps, you can use pieces of a magazine to create a collage. You can use like Play-Doh or any kind of clay, material to create a sculpture of something, or you can, look at something for visual art. So for this project, I found three articles, and they were all pretty interesting, different populations. The first one dealt with people that suffer from personality disorders, and it was the one based off of personality disorder of cluster B and C. And so it was a randomized clinical trial, and 28 people were involved, and there are two groups. The experimental group, they got to experience a guided art assignment through a certified art therapist, and the assignment was focused on improving mindfulness, and it involved like a 10 weekly hour and a half sessions, and they were guided to produce work of art. And the second group, the control group, they didn't get to experience anything, so it was like completely one or the other. So the results showed that there was like scores. They had before and after questionnaires, and the means of the scores showed that it went from 30.5 to 41.61. So they increased the it helped the population increase their positive modes to improve their mental health statuses. So one of the terms that the article used was psychological flexibility. So people, based off of the art, it helped them feel more relaxed and able to cope better with their mental illness. The second article dealt with Alzheimer's patients. So there's a total of 39, and there were two groups. It was a controlled trial. That was the type of article it was, or study. And so group one, they got to do an art intervention. They were able to color using pastel crayons. They were able to draw their own shapes based off of memory, base things off of seasons they liked or animals they liked. And then the second group, they performed simple math calculations, and like adding or simple like 1-2 digits. And now this study took place in Japan, so they used a scale called the apathy scale, and it's very similar to the geriatric depression scale. And the numbers showed they assessed them before and they assessed them after, and they compared the numbers, the means, and the numbers showed that the apathy scores went down. So that means the depression scores went down. And the results showed that the Alzheimer's patients were showing increase of quality of life and vitality. So the art therapy was helping these Alzheimer patients. And in the third article, I liked this one the best. So it involved 34 participants, and now these participants were actually people that were coming in close contact with patients that were going through chemo. So this involved like healthcare professionals that had direct patient contact, or like specific family members, or like really close family friends that were always with these patients. So this one was testing two different art therapy approaches. Group one, they were part of an independent art open studio. So they had the chance where there was a certified art therapist to go in there and help them guide through an activity if they'd like, but they had access to all these different supplies that they could do their own, and they had more freedom. The second group was in a controlled coloring setting. So they had to go in, and they were just able to color like a page, and I think they were using like colored pencils or something like that. Very like limited resources is what I mean. So this study was interesting because it focused on different levels. They measured the cortisol levels before and after each of these art therapies. They also measured perceived stress and positive affect of the participants. And, based off of seeing or hearing about the first group having so many, supplies and resources to do the art activity compared to the other one, both groups showed that they had an increase in their positive affect. Their cortisol levels both actually decreased. Group 1 did have a larger decrease, but they both had perceived self-reported lower stress levels. So it's interesting to see that both, art therapies can help decrease anxiety, stress, and help someone feel better. And they had a qualitative part of the study, and people were quoted their participants, and someone said that, here's my next slide, it takes my mind off of stress and allows for creativity. So I highlighted some of the important parts of these articles and what they highlighted. Patients with personality disorders, like I said, they improve their adaptive modes to help cope with their mental illness. For the Alzheimer's patients, their quality of life and vitality were increased. Cortisol levels were decreased, which is like the stress hormone that was decreased after performing the art activities. And stress was decreased, positive affect was increased, and people were actually saying they enjoyed it. So how can art therapy be done in the hospital? I feel like you have to be kind of creative because there are certified art therapists, and it's, you need to stay in your scope of practice and not kind of go into someone else's when they're certified. However, I feel like we can work around this. So I feel like if you provide the supplies for either the patient or the patient's family, because it is important to keep the patient's support system, to the best of their ability and in good status, and care for them as well, that you can provide the supplies for them to, perform one of these art therapy activities. I also think that maybe you could do like a one-on-one with your patient if you have the time, and like a guided imagery session or something like that. And then yeah, like I said, providing the art therapy session or the supplies, maybe like leading them towards like what they want, whether it's like anxiety, stress, or just like an imaginative session with like a pediatric patient. So there are pros and cons. Like I said, one of the cons I realized researching that there is a specific position as a certified art therapist. So it's kind of hard to, keep it in nursing. But I wonder if there are other programs that a nurse could go in to become a certified art therapist or something like that. There was limited research, actually. Two of my articles were from 2018, 2019. So it was very like recent. There's not a lot of research out there. And I think it'd be interesting to see like different populations. I noticed these are all adult populations, but it would be cool to see children and see if maybe like performing an art activity before like a surgery or something could help or ease their stress. Pros, it doesn't involve medication. It's non-pharmacological. There's no expectation to art. So there's no rules and regulations. People can do whatever, and, that's always going to be right. And it can be done in one session. So with our busy schedules as nurses, it is hard to find that time and, sit down with a patient, do a one-on-one, but it can be done in as little as 5 minutes. But you can also do it multiple times, like in the second study or the first study, they had 10 weekly sessions. So it can go for a long time. But it also depends on the supplies, does your hospital supply them? Who's going to give the supplies? So like that is a factor that I think that we could talk to like management or something, your nurse manager on the floor. Okay, so I have an experimental video that I want you to watch. And prior to watching the video, assess your stress level right here, right now in this moment on a scale of 1 to 10, 1 being not stressed at all and 10 being extremely stressed. And then I want you to watch the video. It's she guides you into a stress relief video, I'm pretty sure. And if you want to follow along, I highly recommend it because I did it. It was so nice. Her voice is very calming. And come back to this PowerPoint, and I want you to rate your stress on a stress rate level of 1 to 10 again, and see if it's changed, if it increased, decreased, or remained the same. For me, I was at a 7 with all the assignments going on, and I watched this video, I listened to her voice, and I did it, and I finished, and I was like at a 2. So I think that it works. But at the end of this video, I have a little quiz to make sure that you got the objectives that I talked about in the beginning. What can art therapy include? How can art therapy influence people's lives? And name 2 ways we can implement art therapy in the hospital. All right. Thank you guys so much.